that will make your post-rehab effective and inspiring. Medfit Rehab will provide a hands-on, professionally supervised conditioning program. Medfit Rehab, Columbus Center, Athletic Department, Dufferin and Lawrence, 647-259-5481, medfitrehab.com. Okay, Dr. Tony Van Hoof, a chiropractor here in Toronto. He graduated from the Anglo-European College of Chiropractic in London, England. He practiced in London for 6 years and now has a practice in Toronto. And he's going to be with us on a semi-regular basis, and we're very happy about that. Tony, how are you this morning?
I'm very good, Zelda. Thanks for having me.
It's such a pleasure. Okay, what is chiropractic? You know, there are a lot of people who have no idea at all.
Sadly, that is the case. And what I'm going to try to do is spend a couple minutes kind of reviewing, what chiropractic is, because many people believe that we're here to treat back pain and neck pain, to do soft tissue work and massage. And although they're very effective and helpful, it kind of has got away from the true way in which we can help most people. Chiropractic started in 1895 when a gentleman called D.D. Palmer, who was actually born in Port Perry, treated a gentleman and did the first adjustments, which actually restored his hearing, which had been lost 11 years previously. So
it restored his hearing?
Yeah. So again, the first initial chiropractors way back in the early 1900s, even when the first school was started, made no mention or referred in no way to the treatment of back pain, but actually how the nervous system was responsible for restoring health.
Wow.
Yeah.
That is a miracle in itself.
So when we actually look at us versus medicine, we're actually talking two different languages. Medicine is designed to diagnose and treat a condition or disorder, whereas chiropractic in its truest form works to restore or build health. And again, maintaining and restoring health is different than treating disease. We often think that our health is how well we look, how well we feel. But sadly, it's we all know people who have looked good and eat well and all that stuff and still have a heart attack or find out that they have cancer. So for us, the real definition of this health is how well you're healing from the inside. So if you want to have a good idea of what you need to do to be healthy, then you should understand where all health and healing comes from. And it's quite simple to understand once you see the kind of things that you can't live without. So, we can live without taking drugs. We can live in most cases without traumas and major occurrences or problems, without surgery. But if you think about some of the basics like food, you can live roughly around 30 days without food. We've all seen Survivor, right? Water, you can live a few days without water. Air, you got a couple minutes. But if I was to cut a nerve completely that went to any tissue or organ, what would it immediately do?
It'd be gone.
It'd be gone. It'd die, right? So with chiropractic, what we're looking to do is to try to restore normal nerve flow, because all health and healing comes from your brain, sends signals down through your spine, which is the only thing that protects it, and allows that heart to beat and the lungs to breathe, even the simplest cut or pain to go away. So if you don't understand what's going on with your spine and take care of it like we do our teeth for a lifetime, all those slips and falls, all those traumas, all those bad postures that we have all the time put more pressure on nerves, stretch nerves, or irritate them in a way that allows them not to function properly.
But why is there, Dr. Tony, why is there so much controversy about chiropractics? Why can't they straighten it out and say it works? And just like in any other field, some do it better than others, some shouldn't be doing it at all.
Well, unfortunately, even within chiropractic, there's a lot of division. So we depending on how it's explained to you. So I would say for anyone who is seeking chiropractic care, you have to have someone who will explain to you what their intention is. If your intention is to get rid of pain, that's great. For a lot of people, that's exactly what they want. So that might be, sort of adjustments done in different ways, which, that they're comfortable with. There might be machines that you're put on. There might be soft tissue work. Obviously, as a maximized living doctor, we talk about 5 essentials. The nervous system is one, but also nutrition, detox, exercise, and mindset are all parts of this that can help. So there's lots of ways in which we can build and maintain health. But the real thing that's missing is taking pressure off a nerve, because without that, you just can't be healthy. So I would say that most people that don't understand or don't seek chiropractic care, sadly, just haven't learned exactly what we do.
Okay, now, so how do you fit into Medfit Rehab? Are you a part of the physicians that take care of patients when in need for chiropractics?
What has happened is I've known Joanne James for a while, and we've always kind of worked together. And I'm becoming more of a part of this because as we start to incorporate more of our systems together to the same people, I'm there to help guide and treat people. Where I fit nicely with them is, our exercise programs and getting fit is one way in which someone can really help manage their spine as well, because for a spine to move or shift in the wrong alignment, we often have to injure the supporting tissues like ligaments. And a lot of those ligaments, once damaged, or you can't fix them anymore. So the more stable or strong that we come in our muscular support, our core stability, the less our spine will shift around. So, us getting people stronger and fitter is really, obviously what Medfit is
and
doing forever.
Is age irrelevant? Can you help someone who's deeply into the, later years, making them feel fit and happier?
Yeah, when should someone start taking care of themselves? Well, the answer is from day one, and they should never stop. So the unfortunate thing is a lot of people, by the time they get to a chiropractor, do have damage to the joints and the discs, degeneration that we can't get rid of. But our goal is to try to manage that cause so it doesn't get worse. So we have patients, right from childbirth right through. My oldest patient currently is 92 years old.
Wow, that's incredible.
So the techniques may need to vary. You need to make sure that person is comfortable with what you're doing, but everybody would benefit from making sure they take care of their stuff.
Okay, Dr. Tony, as I'm going to call you from now on, I'm really very interested in the things you've shared with us. I think they're going to make an awful lot of difference to our listeners, and I know we are going to talk with us on a regular basis, and I'm not sure when the next day is, but I'm going to look forward to it very much. And if you need any of this kind of help, you can reach Dr. Tony through Medfit Rehab and the numbers that you're going to just hear right now. Thank you so much. We'll talk to you very soon again.
All right, Zelda, have a super day.
You too. Bye.
Joanne James, founder and medical exercise specialist of Medfit Rehab, will improve your overall health through medical exercise. Contact Joanne James, 647-259-5481, Columbus Center Athletic Department, Dufferin and Lawrence, medfitrehab.com.